I think the biggest thing I'd say is like really put yourself out there. There's just so many people who want to help, want to give you advice, want to mentor. And it's just that's the biggest thing is like try new things, put yourself out there. Don't be afraid. I did so many different things in high school, and some people might look at it and be like, wow, she just didn't like zero in on one thing. She did so many different things. But that's kind of what I was interested in, and I took my like interests and opportunities as they come. So I don't know, just go with the flow, do what you're interested in, and definitely reach out to people if you have questions.
Hi, I'm Emma Zareen, your host and a 16-year-old engineering student, policy enthusiast, and hopeful future STEM school survivor. Welcome to She Persists. Before we dive in, I just want to take a second to say how grateful I am for each of you. Every listen and every bit of support genuinely means the world to me. When I started She Persists, it started as a little dream to share real stories of young girls in STEM who are challenging norms, finding their place, and inspiring change. Seeing that idea come to life has been so rewarding, and honestly, it's just the beginning. If you've been enjoying these conversations, I'd love for you to be a part of our community by following this podcast. It's one of the best ways to help us grow, share even more incredible stories, and connect with a wider audience. And I hope the conversation doesn't end here. I hope you carry these stories with you and let them be a constant reminder that your voice truly makes a difference. In today's episode, I'm joined by Aanya Gupta, a recent Thomas Jefferson High School for Science and Technology graduate and incoming Duke University student planning to study biomedical engineering. Throughout high school, Aanya has explored just about every corner of the intersection between medicine and technology, from developing public health models that predict vaccine uptake and estimate chronic disease prevalence, to working with patients through Stanford's clinical science, technology, and medicine internship to design assistive robotics. She's also explored quantum software through MIT Beaver Works, led Hack TJ, founded TJ Climbing to make the sport more accessible to students, and is currently working as a software intern at Raytheon on AI algorithms. In this episode, we talk about what it actually looks like to explore your interests without having your entire future figured out, the importance of finding great mentors, building technology around the people it's meant to serve, and why sometimes the best thing you can do is stop worrying about the end result and just follow what genuinely interests you. Anya's story is such a good reminder that you don't need to have one perfectly defined path. You just have to be willing to keep learning, trying, and putting yourself out there. So with that, let's get into it. Here is Aanya Gupta. All right, well, Aanya, welcome to the She Persists podcast. I'm so excited to have you here today and hear about all your experiences and the work you've been doing so far.
Thank you for having me.
Yeah, so I'll just jump into the first question. For listeners who don't know you yet, can you just introduce yourself and tell us a little bit about the work that you're doing right now?
Yeah, for sure. So I just graduated from Thomas Jefferson High School in Northern Virginia. I'm going to be going to Duke in the fall studying biomedical engineering. The past 4 years, I've kind of focused a lot on this field of medicine, AI, and technology, and kind of trying to explore the intersection between those things. Right now, I'm working at Raytheon, kind of just exploring and learning more about the tech space. And yeah.
Yeah, that's awesome, and I'm excited to dive into all of those deeper later in the conversation. But you mentioned you're an incoming freshman at Duke studying biomedical engineering. What are you looking forward to the most, and what are you the most nervous about going into college?
Yeah, that's a great question. I think something that I'm really excited for is meeting a lot of new people. I think I've done a lot of that in the past year, and I think it's just really helpful to be able to talk to so many people, so many new perspectives, and that's one thing I'm super excited for as a freshman. I will say the one thing that like is back of mind is kind of that I don't exactly know what I want to do. And so that can kind of be a little scary sometimes not knowing my like exact path or like what I want to do, where I'm going to end up. But I'm kind of just trying to embrace that. I know a lot of people don't really know what they want to do. So, yeah, I think those are the biggest things for me.
Yeah, and it's still super, super early in your career, so you have so much time to figure that out. And I'm sure you're going to have amazing experiences at Duke as well. So, what made you choose biomedical engineering as the major that you want to focus on?
Yeah, that's a great question. So, originally going into high school as a freshman, I wanted to just be a doctor. So I just wanted to study bio, go to med school. And then, like GPT, OpenAI, all of that became a big thing. And so then I started, like learning how to code and like exploring the like CS side of things, like doing some like engineering stuff. And I was like, hey, I actually really like this. And then I started doing some public health research and, like exploring a lot of other different fields. And I was like, okay, like I also really like the tech space, but I also really like bio. And again, I'm like not exactly sure what I want to do. Med school is still kind of in my head, but like I didn't want to lock myself into that. And so that's kind of how I ended up on biomedical engineering is like you get the bio, you get the chemistry, you can like take psychology, sociology, all of those kind of more science inclined classes. But then like I get to take the math and like I get to build cool things in engineering classes. And I think the biggest thing for me was like getting exposure to a bunch of different things, especially my freshman year and kind of like seeing like what I actually really enjoy doing. And I think the other thing that's kind of great about Duke for me is that and a lot of other places too, is that I don't have to declare my major until the end of my sophomore year. So I kind of have 4 semesters to figure it out. So I may not even stay in biomedical engineering, but that's kind of how I landed on BME for right now.
Yeah, that's awesome. And biomedical engineering is like a super exciting space right now, especially. And they have a lot going on. So that's really exciting. But while in high school, you did do a lot of research. So I'd love to talk about some of those experiences as well. You've been a research intern under Dr. Taylor Anderson since May 2024. How did you end up working with her? And what was that lab or project broadly?
Yeah. So I started working with her through the ASIP program at Mason. And so I was kind of going down the list of professors, and this is around the time when I was kind of interested in med, but also kind of interested in, like modeling and like CS and those kind of things. And so I saw her as one of the things I was like, hey, she combines, like public health with I'd say, like, modeling side of things, and so I was like, "This could be very interesting," but I really did not know much about the space, and so when I started working with her, I think she was really, really she was a great mentor, and, like, that's one thing I tell a lot of people is, like, find, like, good mentors, find people who are gonna, like, walk you through things, teach you things, and so she really, like, sat me down, she taught me about, like, agent-based modeling and, like, how things work in the public health side, and so I took that whole summer to kind of just like learn about agent-based models. And then that's when I started to really like dive deep into the research, but it was a very like step-by-step process of like learning something new and then kind of like applying that. And I think research is just such a like constant field of learning. I don't think I've ever stopped learning. It's like once I have one thing kind of under the belt, then like there's always another challenge, always another thing where you just have to keep on learning, which I think is super cool, honestly.
Yeah, I think that's awesome, especially in like this tech space. There's definitely always new technologies, new kind of softwares to use and stuff like that. So there's definitely, like you said, it's an ever evolving kind of process. But yeah, that's really cool. So you developed a data-driven agent-based model for predicting vaccine uptake that combines survey data with logistic regression to simulate population level health behaviors. Can you kind of walk us through how that model works and what that side of the project kind of looked like?
Yeah, sure. So this model was kind of inspired by the COVID outbreak. And so after COVID, there a lot of like the government federal side and also the more research side were like, hey, what can we do in case there's another outbreak? And so one big thing is the modeling space in which like if you have very minimal data, seeing how an outbreak is going to spread, like what kind of behaviors can stop an outbreak. That's very, very, very helpful, especially with policy making and, like policymakers trying to figure out like what's best for the communities. And so that's where the work kind of originated from was like, how can we create a model that can be used for, the next outbreak? And there's been obviously very, very small scale outbreaks compared to COVID, but like even just modeling like influenza, which is a huge thing every year. So, agent based modeling at its core is basically you have agents, which in this case are people, and you're able to model the networks and connections between these people and see how those connections evolve. And so, in this case, we were looking at disease spread. And so, a lot of the things we were looking at was like, hey, how does mask usage affect disease spread? How does getting the vaccine affect disease spread? How does, like going to the grocery store affect that? So there's just so many different use cases, so many features that you can test on. And so that was the biggest thing for us was like looking at those patterns and seeing kind of what we could catch on to, for like the future.
Yeah, that's really interesting and definitely in a time like right after COVID, that was definitely super applicable. So that's a really interesting field. You also researched small area estimation techniques and proposed a novel approach using iterative proportional fitting to estimate cancer, diabetes, and COPD prevalence. In kind of plain terms, what problem is that small area estimation trying to solve, and why is it so difficult?
Yeah, that's a great question. So when you're modeling with any modeling, like any kind of algorithm, you need data, and your models are only going to be as good as your data. And so in the health field, among other fields, but this is a huge problem generally too, is that there is not sufficient data or the quality of the data isn't good. And so then the patterns that your models show are also not going to be great. And so that was another thing we realized was, hey, is there a way that we can solve this problem? And this was also around the time when there were a lot of budget cuts from the federal government. And so CDC releases, yeah, I would say CDC is like the gold standard for different types of health data. And so they had stopped publishing data. And that was another huge problem because if you're training your models on data that's from, 2023, 2022, that's you're behind in the years. And so you're not going to get recent patterns that then you can again use for research, policymaking, whatever. And so another project that Dr. Anderson was working on was synthetic data generation. And so we were using that to create populations of humans that we could then feed into the agent-based models. And so that was working great. And the basis of that was like the iterative proportional fitting, which is just like a statistical way to generate those populations. And so then the idea came about is like, can you aggregate these populations of data into estimates and create different types of health estimates that then people could use to model or run regressions, train AI models. And so that became another huge avenue of research that we kind of went down into. But yeah, that's kind of the basics of it.
Yeah, that's really cool. Would you say that there are any like downsides necessarily for synthetic data versus like the real world data that you have from like the CDC and other health organizations?
Yeah, I think the biggest thing with that is, again, it's generated data and, as you're saying, synthetic data. And so it's all trained based off of some type of data. And so again, your estimates, your populations, whatever you're generating, that's only going to be as good as the data you're inputting into it. And so if you don't have great data to start with, then your estimates are also not going to be great, which you can see if you generate those estimates and you look at like the regressions of like demographics to like cancer, let's say, and the relationships don't match up to ground truth data. Or you look at you plot the prevalence on a map and it just doesn't look right compared to like what the patterns we're normally seeing, then that's also a problem because then you're generating data that's not, I wouldn't say not real, but the patterns aren't there.
That's really interesting. So, you're also a co author on multiple publications coming out of this work. So, what was the process of going from research to a published paper like that for you as a high school student?
Yeah, I was really grateful to be a part of that. I think it definitely showed me the process of research from start to finish was which was really cool. And it also kind of shows you that research is a very very iterative process. You're not going to get from point A to point Z your first try. I think to get to those publications we had to test things, go back to the drawing board, talk to people who are more experienced in AI, talk to an epidemiologist about the patterns we were seeing. It was very, very back and forth, very, very iterative. And it was honestly, a good test of patience, problem solving. And then once we got to those results that we were looking for and we were at a place where we could publish, then it's like going back and making sure you're writing in a way that other people are understanding. Because I had worked on this project for about like a year now at this point. And so it's like I know this project at the back of my hand, but someone who might be reading this paper has no idea what we were doing. So how can you then communicate these results in a way that other people can understand and then also build on is something that I think is very, very important to be able to do. And that's where I think yes, you could be strong with writing, or sorry, strong with the maths, but it's also really important to be strong with like the writing and the communication part of things.
Yeah, I think research is kind of such like an overarching field. Like you really do need to have those skill sets in like a bunch of different areas, especially like you said, writing and being able to actually communicate your research. So that's
Yep,
a really great
exactly.
point. Yeah. So what first pulled you towards this kind of health related data work specifically?
I think for me, I kind of one, it was just one of the things that looked interesting to me. And it was kind of a good way for me to explore if I liked kind of incorporating the medical side of things with the more computational side of things. So I know a lot of people had done research on like computational biology where it was more at like a microscopic cell level. But I think this was a very interesting application to me because we were looking at more like stuff in like a geographical spatial dimension. And so it was a lot more bigger picture, which is something that I've realized that I liked is I like looking at things at a more big picture scale versus a very like microscopic scale. And I don't think I would have gotten to that point if I didn't explore and take a step into this research.
Yeah, that's really great that you were able to kind of like take that step in a direction that interested you and find something that did interest you and kind of continue throughout that work too and get like a published paper and stuff out of it too. So that's awesome. But I'd love to talk about your experience with the Stanford Clinical Science, Technology and Medicine internship. So you collaborated with the Stanford MedX team and clinicians exploring AI driven robotics for patient centered cars. What was that experience like? And can you tell me a little bit more about the work that you did?
Yeah, I think that was a really, really good experience too because we were able to interact directly with patients. And so the goal of that was we basically spent a summer talking to one patient. She had a chronic illness, and it was, hey, like, what can we build to make her life a little easier? And so originally we were thinking of like, how can we cure her disease? How can we cure her illness? Or how can we make a medical device that makes her life a little better? But at least for that specific patient, the more and more we talked to her, the more and more we got to know her, we realized that, there may not be something in the short term that we could do clinically, but there's a lot of things that she was missing out on. Like I remember we were talking to her about like what she likes to do, and she just kept going to the fact that she loved to knit. But her hands, she had rheumatoid arthritis, and so she couldn't knit anymore. And so that was kind of a light bulb moment for us, which was like, hey, like we have access to great like robotic technologies. So how can we just let her knit? And so that's what we spent the summer doing, was creating something that would assist her hands in helping her knit. So it took away all the like muscular need to knit, and she could just do the movements, and the robotics on her arms would help her with that. And so I think that was a huge learning point for me, in the sense that a lot of times we're just behind a computer doing what we're told, coding for something, building something, but when you really step back, talk to the patient, talk to the people you're building things for, I think it really does make a difference. And we were really able to see that like what we had done, what kind of impact we had made. And even if it was on a very grassroots level, I think it was very impactful, and it was a good lesson for me for sure too.
Yeah, I think that's awesome that you guys were kind of able to help her find joy in something that she enjoyed doing, again, in like a way that was more accessible to her. So I think that's really awesome and a great way to kind of like give back to that health community as well. So, did anything from that internship change how you think about the technology that you're working on, especially in terms of like public health?
Yeah, I think that I realized that whatever I wanted to do, I wanted to be able to see the impact that I was making. And it also, for me, kind of just helped me to constantly think about what I was working on. And again, looking at like the big picture impact of things, of like, hey, this is what I'm actually working towards. Like, yeah, I might be working a couple extra hours on something, but like, there's a reason why. And that's one thing I also really wanted to do when I went into medicine, was make an impact on people's lives, help people when, like they were at their worst or not feeling well. And so I think that was a great reminder of like, even if I go onto the tech side or like biotech, that's still something I could do.
Yeah, and I think that's a really like kind of great realization that you're able to find that like impact and find that aid that you're able to give to others through a field that you find interesting, like whether that be directly in medicine like you were interested in before, or like kind of shifting that focus into something more technical. So I think that's really cool. But you're also part of an international education nonprofit called Giveology. You're head of events and special projects, what does that role involve day to day?
So I think Givology was another great place because it was a lot of another like grassroots impact place where you get what you really put into it. And so everyone who is at Givology is a volunteer. No one gets paid. Everyone does it because they want to make an impact. And so what I was doing specifically was running events in the Northern Virginia area as well as remote events for globally. I ran an event in New York. So there was a lot that we did and it was a lot about, fundraising, raising awareness, like spreading stories. There's a lot of projects that Givology supports around the world, one of them being in Thailand. And so there were a group of students who had written thank you letters for a project that we fundraised for. And so we got to translate them. And it was really fun to see the impact we were making and then be able to share that with other people. And also, it's a really special place to be able to see people who are able to donate or fundraise and, help for a cause and then directly see where that impact is going. So, yeah, I think that Givology is a very special place.
Can you tell me a little bit more about like what the events, especially the local ones in Northern Virginia, kind of what the events were and what you guys did?
Yeah, one of my favorite ones was we had an event at a library where literally we had cookies and we were just letting kids decorate them. And we were talking about like how important education was and kind of spreading awareness to the community around us, but also younger aged kids who, like probably don't know about these things already. And it was just really fun to expose them to those things, show them the types of things that they could be doing as they like grew older. And also, connecting with parents too, spreading awareness. But it was a really fun mix of like spreading awareness, but also, like having a good time. Like they were making little ornaments for Christmas trees, like decorating cookies. So that was a really fun event. We also had an event where we had a partner organization come in and talk to people about the work they were doing for girls' education in Afghanistan. So that was another very like touching event where she shared stories. And just like looking at the amount of effort people put into these things and just being able to see that and spread that with the local communities is really nice.
Yeah, that's awesome. And especially what you were saying about kind of being able to spread this to younger kids as well who might not already know this. I feel like it's super important to kind of put these positive messages in their brain, like from an early age, so that they can kind of like grow into that. So I think that's really awesome that you guys were able to give them that. So you planned and executed 6 fundraisers. Is there one that stood out to you specifically and why?
Yeah, so we had celebrated one of Givology's anniversaries. They had run for, I think, 18 years at that point. And so we wanted to do kind of a big event to celebrate and also fundraise for all the different projects. And so we were planning a little like murder mystery event in New York City. And I think that was one thing like we had started planning a year before. And so we had to find a venue, we had to coordinate with all our partners. It was kind of like a speakeasy theme. So we had to, like decorate, find different places. And I remember that event was so much work, but it was so good at the end. And I think we raised around, I think it was like 16,000 at least for the different projects. And I think it was just such a fun time to be able to create an event where people could come together, share about all the different projects, see people contribute to the causes. And I think that has been one of my favorite events.
Yeah, that's amazing. So what drew you to education-based nonprofit work in the first place?
Yeah, I think I was doing a lot of different things, but I wanted to give back in a way that, felt rewarding and I could see the impact that I was having. And I think that's kind of what drew me to Givology. The other thing is the founder is actually a TJ graduate. And so also kind of drew me to that. And that was another thing was like I was talking about mentors too, and she has been a great mentor. She's taught me a lot. She has a company, but she runs Givology on the side. And so that was also very inspiring is to kind of like learn from her, be able to work alongside her. And so I think those were the two things that kind of drew me to Givology specifically.
Yeah, that's really awesome. So last summer, you did the MIT Beaver Works Summer Institute, specifically with quantum software. So MIT Beaver Works is known to be a very prestigious program for rising high school seniors, and it focuses a lot on project-based courses. Can you tell me a little bit about the work that you did there specifically and kind of what the program focused on for you?
So Beaverworks has different programs that you can apply into. And so I did the quantum software program, which was kind of another thing. I kind of used Beaverworks as a way to explore the quantum side of things. That was another thing I was kind of interested in, but I wasn't exactly sure if I actually liked quantum, and I didn't know that much about it. And so I thought that would be a really interesting summer to spend learning about it. And so that was kind of what I did. But I know that they have like cognitive science, they have like a medical one, they have a robotics one, they have stuff about drones. It's very like multidimensional. And so I had a great time. We did it's a 4-week program. The first 2 weeks they taught us all about like quantum, the software side, the math side. And then the second 2 weeks, you get split into groups and you work on a project. And so for that, we had kind of landed on this. We had looked at different papers and we had landed on this thing where we wanted to use the something called an icing model to model different patterns. And so that was also a really cool experience because that was the first time any of us had really done something so complicated. And so we had the different like Beaverworks TAs helping us, but there was a lot of like back and forth, a lot of problem solving. And it reminded me of research a little is like even if it was just like four of us trying to work through these issues, it was again very iterative. We were going back to the literature a lot and then coming back and coding. And that was also a very good time.
Yeah, that's great. So do you see any connection between this like quantum work that you did and then your public health research, or are they kind of separate fields of interest for you?
So I think the actual content itself is pretty separate, but I think the things that I've learned go very hand in hand is like kind of the patience that's needed for doing hard things, always keeping an open mind, always learning, always being able to ask for help, always going back to like the literature if you're stuck. A lot of those things I think you see in all those experiences. And so it was kind of just being able to apply and practice those skills, but in different spaces.
Yeah, definitely. So you also presented that capstone to an audience of over 500 people. Was that your first time presenting research in that kind of environment, or have you had that kind of experience before? But if so, what was that experience like for you?
Yeah, I think so. We presented virtually, and so I think it made it a little less scary in the sense that like I wasn't looking out at like 500 people. And so that was kind of a little more helpful for me. I don't like public speaking that much. I'm not great at it. And so that's another thing that like I'm working on. But it was definitely intimidating knowing that like a lot of people from Lincoln Labs were there, and these are very, very established people. There were researchers, people from industry, and knowing that, like, hey, these people are coming to, watch our presentations, look at our projects can definitely be intimidating. But it was also super cool to, like, know that, like, our work and all the time we put in was being received by such cool people. So I think it was intimidating, but also very exciting at the same time. And it was fun to, like practice, and we threw in some like cool analogies for like the harder technical stuff. So I think overall it was a really fun experience, but I definitely think that it can for sure be intimidating sometimes, especially when you're talking about such technical things.
Yeah, I think that's a really awesome experience you had there and kind of like to get your foot out the door in that kind of aspect of presenting your research. So, yeah, that's awesome. I'd love to talk about something that you did at TJ. So, you founded TJ Climbing. What kind of led you to start that, and what was that experience like for you?
Yeah, so I've been rock climbing for a while now. And so when I came to TJ and people were like, hey, what do you like to do? One of the things I used to say was rock climbing. They were like, no way. And so a lot of my friends were like, hey, like, you should take us rock climbing. This is super cool. But the one thing about rock climbing is it's a super expensive sport. And so, like just going to the gym for a day pass and then like renting equipment can be very, very expensive. And I was like, the other thing was that I think rock climbing has great communities. Like we'll be rock climbing and you may not know someone at all, but it's very easy to go up to someone, ask for help, make a new friend. And so that was another thing that led me to it was like, hey, the financial part of it shouldn't be stopping other people from exploring this. And I think it's a great way to kind of make new friends, blow off a little steam, also get some exercise in. And so that was kind of the inspiration behind starting it. And so it took a little bit of effort, like talking to different gyms, seeing if they'd give us a discounted rate as a student group, making sure we were teaching people who had never climbed before how to climb properly, like making sure people are warming up so they're not getting injured. There were a lot of different things to think about, but I think the main goal of it was to just create a community where people could come, make new friends, disconnect from all the like academic pressure and that kind of thing.
Yeah, I think that's such a great initiative, especially for something that probably a lot of people aren't really involved in, like something like rock climbing, and giving them that opportunity to kind of explore like a new hobby or meet some new people. I think that's really awesome. So, what was the process of getting it off the ground like? And would you say you had any challenges along the way, or kind of how did that go for you?
Yeah, I think there are definitely challenges. One thing is that, like, when you're working with any corporate company, they always have their own kind of motives. And so, one thing was that it was kind of going back and forth if they would give us a discounted rate, and things like that. And so, the one thing we thought of is that, like, hey, if this, because originally it wasn't a nonprofit, but we were like, hey, if this becomes a nonprofit, then that's something that the companies can list in terms of taxes. And so that's kind of a good way to kind of help us. And so that's kind of like we had to find those little sneaky things. And so things like that was one thing. And then, I had my friends that were interested in it, but like making sure we reached underclassmen. And then at some point we had a lot of guys coming in. So then we wanted more girls, making the environment feel more inclusive. So it was a lot of different things and a lot of back and forth, like outreach and just like safety wise too. And then people were also coming to us and being like, hey, can we do this? Can we do that? So also doing things that other people wanted to do. People wanted to learn how to climb on ropes. So like teaching that. So I think there's definitely challenges along the way, but it's just when people come together like that, it's always just so much fun, and then you see how worth it is.
Yeah, so through all of that, what does TJ climbing look like now, like a couple years in?
Yeah, I think it's a solid group of people, and it's also been nice to have started it and then be able to hand it down to underclassmen to continue it, which is honestly what I wanted. I didn't want it to stop with me. So that the one thing I'd hope is that it continues and it keeps getting passed down.
Yeah, that's awesome. So while at TJ, you were also involved with Hack TJ. You started as sponsorship coordinator and later became director. So can you tell me a little bit about Hack TJ for those who may not know what it is, and how did your view of the event kind of change as you moved into that director role?
Yeah, sure. So Hack TJ is a hackathon. It's an overnight hackathon that we host once a year. It's hosted by a group of TJ students for the Northern Virginia area. And so I think that like I competed my freshman year, and it's a very different perspective going from being a participant and being the one who's receiving everything that the hackathon has to offer versus being the one who is planning it. The hackathon is in March, and then right after that, it's like we take a month of break and then we start planning again. So this is something that we put a huge amount of effort into, and I don't think a lot of people realize that. Like I've had many people come up to me and be like, I thought this was like a week before thing where you guys kind of just like scrap it all together. But it's like we start planning in like April or May because we have to raise money and get sponsorships. There's a lot we have to plan on the food side. Like we want to get cool prizes, but obviously none of this can happen without the money, which is the biggest thing for us. And so that's one of the biggest reasons we start so early. And the other thing is it's a very tight-knit group of us. So it's last year it was 10 of us kind of running the whole thing with our two faculty sponsors, of course. But that's another thing is like it's a very tight-knit group, but that also means that like everybody does have to pull their weight. And so you do get like we had so many like late nights, and you do get really, really close to people too, which was also another great thing. But the second part of your question, that was like, how did things change as I went to directors? That you just find that everything is kind of sitting on your shoulders. Like, yes, everyone has a piece of it, but at the end of the day, it is your responsibility to get things through. And so I would say, I guess it's a little more pressure in the sense that, like, now, like, it was my thing that I wanted to see, like, be successful. And so that was a little more pressure, and also, like, learning how to be a good leader, how to, like, empower the other people on the team, letting go and giving people the creative authority to kind of do what they want. And having that trust that, like, I picked this team, or, like, this team knows what they're doing, and, like, letting them see things through versus me having to babysit every little step of the way. So I think it was also a great year of just, like, learning how to lead, learning what to do, what not to do, what works, what doesn't.
I think it's so cool that you guys are able to put together such an amazing event every single year and really allow a lot of people to participate and kind of explore that field as well. So I think that's just a really cool event. And I'm sure a lot of people enjoyed this past year as well as the previous years, and will continue to as well. So that's awesome. So I'd love to talk about this summer now. So you're currently an intern at Raytheon this summer. So what are you working on there and what are you excited?
Yeah, so I'm a software intern at Raytheon. And so a lot of the work that I do is working on the AI algorithm side. So the specific project I'm on is working on an algorithm for to detect money laundering. And so, like, I think I have never worked in a very corporate space. And so this was my first internship in that kind of space. And so it's been a very good experience so far of, like, learning what it's like and what to expect. And I think what I'm also learning is that, like, things are very different from company to company. And so it's just another good learning for me is, like, exploring, putting myself out there. I kind of had second thoughts of, like, whether I wanted to work the summer before my first year of college, but I'm also really glad I did it because I think I learned a lot, both, technically and also more about the corporate world, whether I want to work a 9 to 5 job, things like that.
What would you say has been like the biggest difference between working at a corporate company like Raytheon versus pursuing research like you did earlier in your high school career?
Yeah, I think the biggest thing, and I was talking to my research professor about this too, is that on the academia side, it's kind of they make their own hours. They can kind of work whenever they want to. They take days off whenever they kind of want to. So the corporate side is a lot more like 9 to 5. You're working 40 hours a week full time. And I'd say it's a little less flexible in the sense that, like, those are your hours per day versus academia. You can kind of spread it out a little bit more how you like. But I think it also gives you flexibility on another side is kind of like you can work a PTO, you can take days off whenever you want. You get holidays and days off and those kind of things. So it's different environments that I think different people thrive in. And so yeah, I think I'd say the other thing to think about with academia is, like, usually if people are going into academia and you end up becoming a professor, you're a grad student, there's a lot more flexibility with kind of like the projects you're working on versus corporate. You may just be put on a project depending on how high up you are, but that can also flip flop. If you're an undergrad working in research, you might just be put on a project by a professor. So honestly, I'd say it's different, but it's also very, very, very dependent on where you're working too.
Yeah, for sure. So, you've definitely had the opportunity to explore a couple different fields throughout the last few years. But is there something that you are excited to work on in the future, or something that you're maybe curious about pursuing that you haven't got the opportunity to quite yet?
Yeah, I think I'm excited to go into my first year taking a lot more, like, engineering classes, a lot more hands-on stuff. I worked on a lot of the computational stuff in high school, and not so much like the hardware side. And so that's something I'm interested in working on the next couple semesters too, and seeing what kind of falls into place. But I think the biggest thing is just finding what I'm interested in and what I kind of want to do now. So I think that's the biggest thing for me.
Yeah, that's awesome. And I'm sure you'll have ample opportunities to explore a lot of different fields while you're in college. So I think that's super exciting. These last couple of questions are a little bit more reflective. So when young girls hear your story, what's something that you hope they take away from it?
Yeah, I think the biggest thing is, like, I think I was very, like, shy and timid early on, and I always got intimidated by the other people around me because everyone's always doing such cool things. And so I think the biggest thing I'd say is, like, really put yourself out there, like, find other girls who are doing cool things, reach out to them. I think I was always scared to ask people for advice too, but there's just so many people who wanna help, wanna give you advice, wanna mentor, and it's just that's the biggest thing is, like, try new things, put yourself out there, don't be afraid. I did so many different things in high school, and some people might look at it and be like, "Wow, she just didn't, like, zero in on one thing, she did so many different things." But that's kind of what I was interested in, and I took my, like, interests and opportunities as they come. So, I don't know, just go with the flow, do what you're interested in, and definitely reach out to people if you have questions.
Yeah, I think that's a really great piece of advice, especially to kind of like take opportunities as they go and kind of just embrace every single opportunity that comes your way because you'll never really know what you'll get out of it until you try. So I think that's a really great piece of advice. But for my very last question, if you could give your freshman year self one piece of advice, what would it be?
Yeah, I think that's a great question. And I think looking back on everything, I'd say that like there's a pressure to kind of know what you want to do. And like there's college apps that like people are always thinking about, but like take the time to explore, find what you're interested in. Don't stress about the end product because you're going to get into college and then someone might be stressed about getting into like med school or law school or, like getting into industry or academia. Like there's always going to be your next thing that you have to do, your next goal. So just I'd say take the time, enjoy yourself in the moment. Upperclassmen have always told me this, and when I was applying to college, I had never really listened. I thought it was just like annoying that they were telling me this. Everything always works out. People always end up where they're meant to be. And so I think that like just enjoying where you are in the present and not wishing for the future so much is something that I kind of wish I had done and is something I'm kind of reminding myself as I'm going into Duke too is to live in the present and like think about the future, think about what I want to do, but also like really enjoy what I'm doing right now, where I'm at now.
Yeah, I think that's such an important thing to kind of remember like throughout your entire life. Is to kind of like embrace the present and kind of embrace what you're working on now and not always be super caught up in what the future has to offer. But I think that's definitely a really great piece of advice that we all need to keep in mind. But Anya, thank you so much for joining me today. This conversation was super fun and I'm really excited that I got to learn so much about your experiences and hear a little bit about the work that you're doing now. And I'm super excited to see all that you're gonna continue to be doing at Duke as well.
Thanks for having me, Emma.
Yeah, and for everyone listening to this episode, if this episode resonated with you, please share it with someone who you think needs to hear it too, and leave us a review on your favorite streaming platform. Thank you so much for tuning into the She Persists podcast, and until next time, keep persisting. Once again, I'm your host, Emma Zareen, and thank you so much for tuning in to today's episode of the She Persists podcast.